The Ministry of Health has received ambulances and essential supplies worth 1.87 million euros from the Intergovernmental Authority on Development, IGAD, European Union and United Nations Office for Project Services. The ceremony was graced by the Executive Secretary of IGAD, Head of Delegation European Union to Uganda, United Nations Resident Representative, and other implementing partners. The COVID-19 essential supplies include 2 advanced ambulances, assorted personal protective equipment, and COVID-19 test kits for Malaba, Busia, Elegu points of entry, and Adjumani refugee camps.
The equipment today includes 4 advanced ambulances, 2 of which are here and other 2 will be delivered soon. Personal protective equipment and COVID-19 test kits destined for the border points of Malaba, Busia, Elegu, as well as the Adjumani refugee camp. I also look forward to the delivery of mobile laboratory that will serve the refugee camp.
This timely donation will cater for enormous needs of the frontline health workers, ease mobility of the responders and those referred for treatment in the districts, cross-border areas and points of entry. It will also enhance public health actions that reduce vulnerability to COVID-19. So far, the project sites that have received the PPEs include Adjumani refugee camps, Elegu point of entry in Amuru district, Malaba, Tororo and Busia, whose representatives you have seen here. Even previously when we received the items and she came here and donated them, they also came and received the same items. One of the areas in Uganda where we still have cases coming, maybe 6, 7, is the Elegu point of entry. So that is the point of entry that needs, a lot of our intervention to make sure that the number of cases reduce.
The supplies are aimed at strengthening the response against COVID-19 in the region and to be used mainly at selected project sites and cross-border areas. The project aims to support over 1 million people across the border sites, focusing on the provision of healthcare services, wash services, supporting quarantine and isolation centers, among others. The Executive Secretary of IGAD disclosed that IGAD has formulated a regional COVID-19 vaccine plan that has 2 objectives of promoting early and sufficient access and also eliminating existing barriers in the region.
Regional European Union grant of 60 million euro. This regional action aims at helping the countries concerned to address these multiple challenges. It will increase access to health and to critical medical equipment, and it will provide socio-economic support for vulnerable groups, specifically in cross-border areas. In addition, this action will support the development of digital solutions for the COVID-19 response, such as a regional surveillance and monitoring system.
Power frontline personnel at border points to ensure the safety of IGAD citizens as they trade, visit their families, or cross borders in search of education or employment. I would like to convey my profound appreciation for including the refugee host communities in this donation. This is in line with our collective efforts to make sure that no one is left behind during these unprecedented times.
The procurement of the supplies was within the framework of the EU IGAD COVID-19 Emergency Response Project that was set up and has been implemented in all IGAD member states of Djibouti, Ethiopia, Kenya, Somalia, South Sudan, Sudan and Uganda. Zahra Abigaba,